My name is Geneva, and this is task 8 for my veterinary diagnostic imaging capstone project, and it is a barium GI contrast study. And today we're going to be doing an alternative study, so we're going to be using a stuffed animal who I've prepared. I've taken all the stuffing out and put a bag in, and we're going to be administering some barium and then taking some radiographs today. So first we're going to talk about indications for a GI study. Recurring vomiting, if the animal has something wrong with them, can't figure out what it is, you suspect maybe a foreign body or blockage of some sort. But some of the indications could be recurring vomiting, diarrhea, bloody vomit, not eating, chronic weight loss, abdominal pain that's been going on for a while and you just can't figure out what it is. Then you can do a barium study to see if there's any blockages, anything like that. Some contraindications to the study would be if you want their stomach to be empty, so fasted for 12 to 24 hours, or you can administer an enema if they're eligible for one, 2 to 4 hours before the study. Should not be used in patients with GDV or torsion of the stomach, and anybody with obstructive bowel disease or ileus should be suspect. You possibly shouldn't do a barium study in that. So let's see, we're going to begin. I have measured my stuffed animal, and it's 5 centimeters. Actually, it's 5 centimeters in VD and lateral position. So I've set my machine. We have KVP of 70, MAS is 2.5, and MA is 400. Let's see here. I have all of my supplies. I'm going to be using a red rubber catheter today. Alright, so I drew up 32 mLs of barium. The patient is 10 pounds, and which is 4 kilograms, and we're going to be administering 8 to 10 mLs per kilogram for patients under 10 kilograms. So 32 mLs is what we're administering today. When I did measure, I measured over the TL junction, the thickest part, and I forgot to mention that the upper GI study lets us see the size and shape of the stomach and the intestines, any contents of the stomach, and it lets us see if there's any lesions on them as well. So very good study to do when you suspect certain things. So let us begin. First I'm going to be taking a scout study to make sure that we actually still need to do a barium study. So we'll do that first, and like I said, my machine's all set up. I'm going to just dim the lights here a little bit. Alright, so there we go. I've got all of my protective gear. I've got my apron, my thyroid guard, my dosimeter, and I have my lead gloves. So, just fixing the computer over here. For our scout study, we're going to be doing a right lateral study, or right lateral radiograph, I should say. So I'm going to have my patient here, who's sedated, and going to, so he's on his right side. I have my my right marker here. Just extend the legs, and then we're going to collimate from the level of the 9th T9 here to the acetabulum. Alright, I'm going to have the glove on. Alright, patient is ready to go. Let's try that again here. There we go. Alright, so I would then look at my, show you that. course, not a whole lot's going to show up here. That is my, I must have forgotten some stuffing there, my scout radiograph. So I'm going to set my camera back up. All right, so we are ready to administer our barium since we've done our scout radiograph. So the patient's going to be put into a lateral position here, or excuse me, a sternal position. And make sure you can see that. We are going to measure, I guess I should measure first here. We measure from the canine tooth to the 13th rib. I'm going to put it back in lateral here. There we go. To see how far we're going to need to insert this. So I go that far there. And then I'm just going to take a little piece of tape and take that off. The reason we do this is because we don't want to insert the tube too far. They can cause damage to the stomach and the gastric wall. So I have my tube pre-measured and taped, and we're actually just using a red rubber catheter today. Now we're going to put the patient in sternal position. I'm going to use a mouth guard. Use a 1/2 inch to 1 inch roll of tape. And this little guy kind of has a small mouth, but we're going to make it work. Of course, it'll be a lot easier in a real animal. There we go. All right, so I'm going to lubricate the end of my catheter. And some lubricant I have on a paper towel over here. And we're going to insert it down the esophagus and into the stomach to the point that we pre-measured right there. Just like that. And I'm just going to keep the gag in so that the patient can't bite down in case they wake up. A way to check that it is in the right place is we're going to instill 5 mL of water to make sure that we don't hear any coughing, to make sure that we didn't get it into the wrong spot and then it went into the trachea or anything like that. So there's that. And we are good to go, so I'm going to actually administer the barium. And so I have my barium here. In a mess. Just going to do a little less than said because the stomach's a little small. In a real animal that is that size, we would definitely do the 8 to 10 mLs per kilogram. Just my bag is a little small, so I'm not doing the full amount there. Clean that up real quick. All right, so when we do take the tube out, we are going to follow it up with a little bit of water to make sure that the tube is clear. Excuse me, a little bit of air to make sure the tube is clear. And then we're going to keep the tube and pull it out so we do not cause aspiration. Just like that. And then I can take the mouth gag out. And we are ready to take our radiographs. All right, so immediately after administering the barium, we would take 4 radiographs of this real live patient. We would do a VD, a ventrodorsal, a dorsoventral, a DV, and then left and right lateral. For our purposes today, we're going to be doing, I just administered the barium, so we're going to be taking a right lateral, make sure that the barium was administered correctly. So I have my patient here, still in position. And earlier I misspoke as well. When in lateral position, you want to measure from T7 to, or you want to collimate from T7 down to the acetabulum, not T9. So there's that. And then I just need to set this to right lateral again. Take another picture here. And I'm going to also collimate that up just a little bit more. Make sure we're getting the whole thing. All right. There's my marker. And over here, well, our stomach bag looks a little strange, but it is in the stomach. You can see this is where this, excuse me, this is where the spine would be here. There you go, where the spine would be, the head's up here. So we did get the barium in the stomach, so we are gonna do that's our right lateral, and then we're gonna do our VD next. Alright, so place the patient, turn the light on, place the patient in a VD, excuse me, here we go, a ventral dorsal position here. Legs extended. And then in a VD shot, still in a colonnade here. In a VD shot, we go from the acetabulum to the to T9. T7 is in lateral, T9 is in VD. All right. So we've got our markers. I have my right marker and my VD marker. My glove back on. And here we go. Earlier when I measured it, the measurements were the same, so I'm keeping all the settings, the technique the same on the machine. So, all right. I can take a look at this one. There's our VD shot. So, looking good. So, as I was saying earlier, immediately after instilling the barium, we would take our 4 radiographs, VD, DV, right and left lateral, and then we take them at 15 minutes. We take a right lateral and a ventral dorsal. That's when we can see the barium in the stomach and the duodenum, and then at 30 minutes, we should be able to see it in the stomach, the duodenum, and the jejunum. And then we take another one at 60 minutes, and then we take it hourly until it's out of the system. Each of those times, immediately 15 minutes, 30 minutes, and the 60 minutes, we would be taking a right lateral and a VD radiograph. And then as far as when it's out of the system, the majority of the barium will be out of the stomach. So as soon as you notice that, then your study is finished and you can wake up the animal. One more thing I was going to show you on our radiograph here. It is marked with patient's name, date. We have our settings over here and our studies, or excuse me, our radiographs, and we'll also put when we file it, we'll have the patient's, the client's name, the clinic's name, and all the other information necessary. And then I'll also include that in my study too, or in my capstone. So that is taking radiographs and a barium study for GI contrast.